Hello, my name is Christopher Smith and I'll be speaking about cryotherapy today in this presentation. First of all, if there are any questions that come up during this presentation, please don't hesitate to ask. In this presentation, we'll focus on three objectives regarding cryotherapy. First, the viewer will know what cryotherapy is. Second, the viewer will be able to identify the benefits of cryotherapy. And third, the viewer will learn of some inexpensive items that they can create to be able to use at home for cryotherapy. First, let me start off with a question. How many in here in the audience have ever experienced an injury to which they were able to use a cold compress? For those of you who answered, well, you already know what cryotherapy is because you've been using it. For those who are not aware, in simple terms, cryotherapy is the exposure of the body to very cold temperatures for the purpose of treating muscle and joint pain. One of the great qualities of this type of therapy is that it can be done at home as well as in a physical therapy office, so the patient isn't limited from a geographical standpoint. The treatment is also used to alleviate muscle sprains and cramps, ultimately reducing pain and swelling, which of course is the ultimate goal of any type of PTA. After all, the patient only wants to get rid of the pain. This is especially effective for those suffering from such conditions such as arthritis, and degenerative joint and soft tissue issues. This is especially true with my wife who has rheumatoid arthritis. So what about the history of the treatment? Well, in early 2500 BC, the Egyptians used cold to treat injuries and inflammation. Napoleon's surgeon, Dominique Jean Larrey, between 1845 and 1851, used it to facilitate amputations during their retreat from Moscow. Dr. William Pusey, on the other hand, used solidified carbon dioxide to treat conditions such as warts, vascular nevi, lupus, as well as epitheliomas. But before we continue forward, I have a true or false question that I'd like to see just how much you guys already know about cryotherapy. So true or false? Cryotherapy dulls pain at the site of an injury by way of opening blood vessels. Answer? The answer is false. Cryotherapy actually constricts the blood vessels, a concept that we'll speak of momentarily. Now, the usefulness of cryotherapy is in its benefits that arise from its use. Arguably, the most important benefit that can be attained from its proper use is the treatment's ability to abate pain. The treatment soothes pain by slowing the release of chemicals that cause pain and by inducing a release of endorphins as well. Now, endorphins are used as a natural pain medication for the body, for those that aren't aware. The application of cold to the affected area also causes the blood vessels nearby to constrict, an occurrence also known as vasoconstriction. This alleviates pain by reducing the blood volume to the site of the injury, thus reducing the swelling and dulling the associated pain signal. Now, cryotherapy also reduces the metabolic rate of the muscle, which also decreases the amount of oxygen the muscle requires, and also reduces inflammation, ultimately as a result. In addition, the treatment itself reduces muscle spasms, which helps the body by decreasing the muscle's ability to maintain a contraction. Finally, it helps by promoting faster muscle regeneration, also known as healing. So, with regard to cryotherapy, are patients only restricted to those tools that are provided by a physical therapy office? Not quite. There are actually three ways a patient can still get effective cryotherapeutic treatment at home. This can be done by way of a few very inexpensive, very basic items. The first involves frozen food. This can be done with almost any kind of frozen bagged item. It's not just restricted to a particular type of food. When my wife fell a few weeks ago and sprained her left wrist, I used frozen peas initially on the affected area after we got her home. Once we got home, we used a second cryotherapeutic tool, which I'm going to mention, also known as a makeshift cold compress. In order to do that, we used this. Of course, it's melting, it's all over the place. But this was excellent in that we were able to take this and we're actually able to wrap it up in a hand towel. Now, why a hand towel, you ask? This is very important because one of the things that's the most important about the use of cryotherapy, aside from being able to use things like frozen food, is that you have to be able to avoid allowing it to be applied directly to the skin. It is very easy for the skin to burn. It's not just limited to heat, it also includes the use of freezing as well. You can have freezer burn, believe it or not, on the skin. So what you need is a buffer between the actual compress and the skin itself. So it's kind of a Goldilocks and the Three Bears kind of effect, where you don't want it too thick, but you don't want it too thin. If it's too thick, it defeats the purpose because the cold won't actually get to the skin. If it's too thin, you might as well be putting it directly on the skin. So what do we use? A hand towel. A hand towel, in my experience, is the perfect thickness for what you need. So we've already explored two of them. Now we still have one more, which involves our next true and false question. This item can be inexpensively created and used effectively to apply cryotherapy as well. Now this item has three parts to it. The first thing you need is a Ziploc bag. The second is 3 to 4 cups of water. The third item is actually in the true or false question. Now, this ingredient is essential, and it'll keep the water in the Ziploc bag from freezing solid after prolonged periods in the freezer. So, true or false? This item is known as rubbing alcohol. The answer is true. The last item which could be created and used for cryotherapy involves taking rubbing alcohol and water and mixing it into a Ziploc bag. Be sure there's more water than rubbing alcohol. The beauty of this is that the alcohol keeps the water from freezing, which allows the liquid to be especially cold and useful. I still would also exercise caution and don't apply directly to the skin. So, in conclusion, what have we learned about cryotherapy? First, we learned it is the exposure of the body to very cold temperatures for the purpose of treating muscle and joint pain. We learned that the benefits of such treatment involves its ability to abate pain by way of vasoconstriction and by causing the release of endorphins. Also, with regard to its benefits, we also learned that it reduces the blood volume in the affected area and thus decreasing the swelling as a result. Finally, we learned about frozen food items, makeshift cold compresses, and Ziploc alcohol water cold packs, all very effective ways to receive the benefits of cryotherapy without the hassle of paying a great deal out of pocket. It goes without saying that the patients really have something great in a concept such as cryotherapy. I'd be remiss if I didn't reiterate my previous warning, however. Do not, under any circumstances, directly apply a cold compress against the skin. If a patient is to use this therapy, this must be followed, and they must not have the treatment applied any longer than 15 minutes every 3 to 4 hours. Now, with that said, are there any questions? That being said, for the purposes of maintaining academic integrity, I give you the reference slide. Thank you very much.